Hello, my name is Al-Nabulsi. I'm a master's candidate at the School of Nursing at San Francisco State University. The purpose of this instructional video is to present information about blood pressure screening from the United States Preventative Services Task Force. At the end, I will demonstrate how to take a blood pressure measurement. The U.S. Preventative Task Force, USPSTF, makes recommendations about the effectiveness of specific clinical preventative services for patients without related signs or symptoms. High blood pressure is a prevalent condition affecting approximately 30% of the adult population. It is the most commonly diagnosed condition at outpatient office visits. High blood pressure is a major contributing risk factor to heart failure, heart attack, stroke, and chronic kidney disease. In 2010, it was the primary or contributing cause of death for more than 362,000 Americans. The USPSTF found good evidence that screening for and treatment of high blood pressure in adults substantially reduces the incidence of cardiovascular events. The USPSTF recommends annual screening for adults aged 40 years or older and for those who are at increased risk for high blood pressure. Persons at increased risk include those who have high to normal blood pressure, 130 to 139 over 85 to 89 millimeters of mercury. Those who are overweight or obese and African Americans. Adults aged 18 to 39 years with normal blood pressure, a blood pressure of 100 lower than 130 over 85 millimeters per mercury, who do not have other risk factors should be rescreened every 3 to 5 years. The USPSTF recommends rescreening with properly measured office blood pressure, and if blood pressure is elevated, confirming the diagnosis of hypertension with ABPM. Office measurement of blood pressure is most commonly done with a manual or automated sphygmomanometer. Little research has been done on the best approach to measuring blood pressure in the office setting. Most clinical trials of hypertension treatment, at a minimum, use the mean of 2 measurements taken while the patient was seated. Some use the mean of the second and third measurements. Allowed for at least 5 minutes between entry into the office and blood pressure measurement, used an appropriately sized arm cuff, and place the patient's arm at the level of the right atrium during measurement. Multiple measurements over time have better positive predictive value for hypertension than a single measurement. Automated office blood pressure, which is an average of multiple automated measurements taken while the patient is alone in a room, may yield similar results to those of daytime ABPM. Blood pressure is affected by various short-term factors, such as emotions, stress, pain, physical activity, and drugs, including caffeine and nicotine. In addition to within-patient temporal variability, isolated clinic hypertension in the medical setting and in the presence of medical personnel, known as white coat hypertension, is well documented. Epidemiologic data suggests that 15% to 30% of the population believed to have hypertension may have lower blood pressure outside of the office setting. The disadvantages of diagnosing hypertension solely in the office setting include measurement errors, the limited number of measurements that can be made conveniently, and the confounding risk for isolated clinic hypertension. Now, the patient Jordan will join me, and I will demonstrate how to take his blood pressure. Jordan?
Hello.
So Jordan, take a seat. For the blood pressure reading, you're going to need a stethoscope and a sphygmomanometer, and I'm going to do a manual reading. First, I'll take Jordan's blood pressure on his right arm. So I'm going to take Jordan's arm, turn it up, and then put the cuff onto the artery mark. I don't want to wrap the cuff too tightly, and I want to make sure that the cuff is appropriately sized. And then I want to inflate the cuff until the dial goes to 200. I'm going to let the seal on the bulb loosely. And I'm listening for the first thump. And then the last thump, and I'll release the dial. So Jordan's blood pressure in his right arm was 100/80. Now I'm going to take his blood pressure in his left arm and average the two readings, using the same technique I used in the right arm. I'm holding his arm at the level of the atrium. Jordan's blood pressure in his left arm is 120/70. Thank you, Jordan. So I would take the average of those two blood pressures and I would calculate his blood pressure. So 100 plus 120 is 220, divided by 2 is 110, and then 70 plus 80 is 150, and then I divide that by 2, and that's 75. So Jordan's blood pressure would be 110/75. According to those two blood pressure readings, Jordan has a normal blood pressure. And just as a review, blood pressure, the systolic number is the pressure of the blood against the arteries when the heart is pumping, and the diastolic number is the pressure of the blood against the arteries when the heart is relaxed. That concludes my instructional video. Thank you.